Recognizing the member from Saanich North and the Islands.
Thank you, Madam Chair. And to the Minister, just a question about the Lady Minto Hospital emergency room extension project that is currently underway. I've written the Minister on this. I believe the Ministry is aware of my advocacy on this. But just very quickly, the Lady Minto Hospital also serves as the de facto walk-in medical clinic for my constituents on Salt Spring Island. In fact, Salt Spring Island is the largest community without a walk-in medical clinic. There's 11,000 full-time residents. The population of Salt Spring has quintupled since the current Lady Minto Hospital opened in 1958. While Island Health acknowledges that there's need for improvements, they've entered into a memorandum of understanding with the Hospital Foundation to design and build a new emergency department. The foundation is responsible for 100% of the capital costs, and Island Health has agreed to 100% of the operating costs. I think that this will be an example of a community who's being overlooked by the Ministry of Health. I know the Minister has made a lot of announcements for capital investments. I think that it's been framed, unfortunately, that the community is all too happy to fundraise for this hospital expansion project, this emergency room expansion project. Although I think that that's the wrong frame. The reality is that this community is being forced to fundraise entirely for the capital costs of this project, unlike many communities across the province, represented by members from all across the legislative chamber. I'm just wondering if the Minister and the Ministry could contribute to the capital infrastructure improvements that are so greatly needed on Salt Spring, not only for the emergency room, but as well for the inevitability of a walk-in who might not be going to an emergency room in another community, but because Salt Spring doesn't have that walk-in clinic or an urgent primary care center, that this hospital ends up being that service as well.
Noting the hour, Minister, I know.
I clearly need to answer more quickly. There's no disagreement in this room. There's lots of ayes in that response. The Lady Minto Hospital expansion project has been approved and is proceeding. It is fantastic news. Remember, it isn't quite right. The foundation is contributing a portion. The Capital Regional Health Hospital District is providing the balance of capital funding, and we're grateful to both. It's exciting to see it go ahead. Obviously, we're supporting operating funding, which is over time the most significant part of the funding that Island Health is. But this is just fantastic news, and I would like to at length describe both the deficiencies of the current ED and the emergency department and all the things that are happening. But I just want to thank the people of Salt Spring Island for having been part of this. It's going to improve care on Salt Spring Island. It makes it easier, as we've said in the case of Cowichan, to recruit people. It's going to make care better. And I just couldn't be more exciting to say it's been approved and it's proceeding. And to say to the member, if I could, because this is the last answer, I think, in this morning's session. I've been given the note saying that I have to move the motion and everything else. So I think there's something that he and I need to do together, because his constituency, 3/4 of his constituency, leads British Columbia in vaccinations. He will know that the community health service area involving the other islands is at 88%, and Sydney is at 87%, and North Saanich is at 86%. And Salt Spring Island's not doing badly, but it's at the provincial average. And what I'd ask him to do is to continue to push immunization on Salt Spring Island with us, because I think Salt Spring Island can't be left behind. The rest of his constituency is leading BC. That average is not good enough for Salt Spring Island, and that we need to raise immunization levels there. And I hope that, I look forward to working together with him to see that happens. A little internal Saanich North and the Island competition perhaps we can have to see those immunization rates come up. But it's great news for everyone. I thank him for his support of the Lady Minto project, which is going to make things healthcare better on Salt Spring Island. And it is, I just can't be more excited to speak about that project. I wish I had more time.